Hey everybody, and welcome to DocTalk. I am Dr. Erin Knopf, and I am joined by someone who is a new friend to me and a new human that I just can't imagine now not knowing this person. Eric Pothen is joining me today to talk about eating disorders in men. So, Eric, first, please tell us a little more about you, and then we'll dive in.
Yeah, absolutely. So my name is Eric Pothen. I live just north of Minneapolis in the good old state of Minnesota.
Ah,
I always have to pronounce it like that because I feel like we always get called out for our accents here. A little bit of background about me. Before landing in the eating disorder space, I was actually a middle school choir teacher for 7 years. And so I never thought in a million years I would be teaching middle schoolers for my
they're tough.
occupation. They are very tough. You're going to experience some in the next probably 5, 6 years. And then B, I never thought in a million years that I would ever leave teaching and end up here in this space of being an eating disorder recovery coach. I've been a recovery coach now for about 2 years, and a lot of my passion for that comes from my own lived experience with an eating disorder and being more vocal and sharing my story with others and doing some eating disorder recovery advocacy work. I think that passion is what ultimately led me to wanting to contribute to this community even more and in a more individualized way. So that's kind of what led me to seeking out recovery coaching. This fall, I'll actually be heading back to grad school to pursue a degree in counseling to be an eating disorder therapist.
Amazing, because we know we need more men in the field of mental health as a whole, but definitely in the eating disorder treatment field. I'm all for girl power here, but you never want just one demographic dominating when we know eating disorders don't discriminate. And that means men are no exception. So if men are going to have eating disorders, we also need men in the treatment seat as well.
Yeah, absolutely. And I think that's one of the most important things that I try to talk about in my work and to really raise awareness around is that eating disorders don't discriminate, right? In terms of age, gender, sexual orientation, religion, all that, right? They don't discriminate. Anybody can develop an eating disorder. And I think that's one of the biggest areas of education that I'm still seeing and having conversations with folks. I went into the middle school I taught at to facilitate an basically like an eating disorders 101 lesson with seventh grade health classes. And
Nice.
in one of the first questions I asked, what are the first things that come, or what are the first words that come to mind when you hear the words eating disorder?
And what did the seventh graders say?
They said skinny and girl.
Skinny white girl, maybe
Yes,
even?
skinny white
Yeah.
girl.
Mm,
Teenage too, right?
totally. I
Hmm.
also wonder, did you ask that health teacher who was smart enough to bring you in? So maybe this won't have been an issue, but did they have the kids ever calculate their BMI? Because I hear that from health classes all the time.
Yes, yes. I will say though, this health teacher is really mindful of what the curriculum is in their health book. I looked through it before I went and it was terrible, terrible,
Ay,
terrible. It reinforced a lot of the common misperceptions people have about eating disorders.
dang
Yeah.
it.
Which I looked at when it created this curriculum and when this textbook was printed. And I want to say it was back in even like 2020.
They're not even that old. We don't even have that excuse.
Hmm.
Oh, well, that's a whole other conversation of how our society still reinforces and creates the perfect breeding zones for eating disorders. But let's get back to men.
Yeah.
So I always like to remind people that 6.6 million men at some point in their lives will experience an eating disorder. Maybe it's subclinical. Maybe they just don't know to recognize it. I think that's a big thing that happens. So people assume that behaviors are going to look like, anorexia, its purest form, food restriction. What about bulimia, binging, purging, that kind of thing. But with men, it can be so much more subtle when the dysfunctional behaviors are happening. So I'm curious, what's one that you like to really bring awareness around specifically?
Yeah, I think before I do that, Erin, I think I want to go back to that statistic that you gave
Yes,
of
go back.
6.6 million.
Million.
That's a lot, right?
A lot.
But I always hear the stat of like, okay, of those that struggle with an eating disorder, 1 in 4 are men, right? But those are men that choose to like admit, right? I don't like to use the word admit, but
Be in the
yes,
light about this.
yes, right. And when the surveys come out, they self select, right? They report.
So true.
But I think that number is much higher.
Yeah, totally, totally. And also, who was asked? And I don't know about you, but I see studies all the time saying, oh, the average American thinks this. I'm like, well, I wasn't asked. Who gets asked? I'm so curious how we come up with these.
Hmm.
You make a great point. You
Hmm.
make a great point there. Say more.
Yeah, I feel like it's so important to talk about that, right? Because I think there is such a strong stigma attached with being a male and struggling with an eating disorder. I think there
Mm,
is a lot of shame that comes up for men in particular if they are struggling with an eating disorder, food, body image, exercise, etc., because eating disorders are viewed as something typically that women struggle with.
yeah.
And they think that it affects and will take away from their overall masculinity, or they'll be less quote unquote manly if they are struggling with one of these things. And so I think because of fear of judgment from others, fear of shame, I think it actually doesn't allow them to want to be brave and to self report on those surveys or go in and maybe speak to a doctor and say, I'm actually struggling. I think I'm struggling with something. I don't know what it is, but I think I need help.
I think you named the bigger problem that men unfortunately experience. They are not given historically space to explore feelings, to explore vulnerabilities. That is the opposite. So there's so much more insecurity around admitting insecurity. I think in men, it's almost acceptable in a bigger way for women to have emotions, but men are no different. They are wired with the same wide range of emotions. And this is something that is still a work in progress, I think, for everyone in the mental health field of how do you help men communicate emotionally and effectively without fear of judgment and repercussions. It's a tough one.
It really is. Because I think it's so hard as I'm getting older. A lot of the learning I'm doing in life is actually unlearning
Mm,
what I was taught in my younger years of life.
totally.
And I think that's what feels really challenging for men. Deep down, there is this desire to want to be able to share vulnerably.
Yeah.
But I think there's such cognitive dissonance between that, what they're experiencing of wanting to share, versus what they were socialized to think about emotions and
Yes.
expressing emotions when they were younger, right? I feel very lucky actually because my dad was actually a very expressive and still is a very expressive male figure in my life. And so for me to have that modeling made me feel very safe.
Mm,
And so I think it's really how do we create that container and environment where men, once again, don't feel like there is shame or guilt to be experiencing and expressing emotions and not having it be seen as a weakness.
yeah, totally. Well, especially eating disorders, we've said a lot on this program. It is a weaponization of nutrition around either a dysfunctional relationship with food and body self analysis, but it also is a maladaptive coping approach to intolerable feelings, meaning the big ones that create the most feelings of shame and guilt. Eating disorder behaviors seem like a solution. In fact, how many people hear from their doctors, from their family members, oh, you're depressed. Oh, you've been through a trauma. Work out more, focus on clean eating, get healthier, quote unquote, in your life. I mean, that is the slippery slope to being in an eating disorder. And the other part, too, is the fact that we are all directed by body hierarchies, right? And traits that are considered superior and desirable and sexy. And if you want to have a partner, this is the trait you should strive for, even if it means manipulating your body. So it creates the breeding ground for anyone to have a dysfunctional relationship around food and body. And again, men are at the front of this. They see Chris Pratt, for example, he can go from being on The Office and kind of a dud to this hottie on Guardian of the Galaxy and think, oh, see, it's just a matter of the work you put in, the discipline you put in, the macros you count, right? But no, that actually comes at a huge cost. And most bodies are not supposed to look like that ever.
I think that's the downfall really of media,
Yeah.
right? Is that I think media makes it seem like it's this easy fix, just exercise more, just eat the right foods, right? But I think kind of going back to your earlier question though, Erin, of like what are maybe some of the disordered behaviors that are more normalized
Oh,
within men that are actually disordered, right? I want to kind of go back to that because I feel like it aligns really well with what we're talking about right now. But it's like the clean eating, the obsession of clean eating, of bulking, of cutting. A lot of this narrative and language is so commonly used within the male community, from your bro to bro talk, right? They're at the gym, like, yeah, I'm hitting my macros, I'm pumping, I'm PRing this lift. And after this, I'm going to go home and do a double scoop of protein and just all of that talk. You know what I
creatine,
mean?
get swole, get
Yeah.
swole.
Yes. But I think what is so interesting is that I think a lot of just individuals believe that like it's just a normal thing for men to be into changing the way their body looks and to be weightlifting and to be clean eating and to be talking about bulking
Yeah,
and cutting, right? It just becomes so normalized that I think people have a hard time being able to pause, zoom out, and see that actually some of these behaviors that are quote unquote normal are disordered. And
100%.
and I think that's something that I'm trying to raise more awareness around too, because I think a lot of men go undiagnosed, right? With an eating disorder. Maybe if they do choose to go in, that actually, oh no, they're active, they're weightlifting, all that. There's like no red flags, no concerns because it's quote unquote normal behavior for men.
Yeah. And pro health. I mean,
Yes,
again, a
pro health.
physician would absolutely say, oh, that's fantastic. I wish all my patients would do that. No, wrong messaging, wrong messaging. If you are spending more than 10 minutes a day thinking of macro balances, no, already is a problem. If you are spending more than 2 hours at the gym multiple days a week and you are at a stage in your life where you have other responsibilities like a job, family, pets, no, not normal, not normal. If you're missing social events because you didn't go to the gym that day, not normal.
Hmm. Yeah. And are you restricting what you're eating in the day because you haven't moved? Not normal.
Hmm. Totally. This compensation, your compensatory pendulum back and forth of, oh, I can eat this when I move, or I won't eat this if I don't move. Not normal. Disordered. Big red flags.
Yes. And I hope people listening to this conversation, once again, I think I tread lightly saying some of these behaviors because for some, maybe engaging in these behaviors isn't disordered in any way, right? But I do think for some, it's important to be aware of what is the intensity of these thoughts? What is the result if you remove one of these from the equation? How does the individual respond? And I think that's going to give you your answer of if it's something to be aware of or.
I appreciate the gentleness you brought there. You're right. I'm sorry if anyone listening now feels really called out. At the end of the day, it is individualized. You need to talk to a provider. But if you're even asking yourself the question, is this a problem? Chances are it's more likely problematic than not. I think what's really hard too is so many people actually might be struggling with a whole other condition called body dysphoria or dysmorphia, where you see yourself inaccurately. You have this excessive preoccupation, obsession with a part of your body or your overall physique, where you see it as problematic and needing to be changed when you just aren't seeing yourself accurately in life. And it only pertains to your self assessment, not how you see other people. You see other people totally normally. This has to do with a parietal lobe issue, not actually a problem with your body. So again, be curious. I know we talked about that before we started recording. This is about being curious. And if anything feels like, maybe that does describe me, we really encourage you to explore more. We
Mhm.
really do.
Yeah. And I think I want to touch on bigorexia a little bit. I feel like I often forget about that one too, but I'm starting to use that more actually with my clients because I have a lot of clients that are coming to me talking about feeling a lot of distress about the size of their muscles,
They're
right?
not
And
big
that
enough.
they're not big enough. And so it leads them to engage in some behaviors like over exercising, eating an excess amount of protein, because there is such a distress about the fact that their muscles aren't big enough. They're
Yeah.
body checking more regularly too. Those that experience body dysmorphia too can engage in that body checking and looking in the
Yeah.
mirror often as well. Um, but I think bigorexia, I think that's something I feel like when I've talked about that term with my clients, they've resonated with it and they're like, "Oh my
Mhm.
gosh, like I finally feel seen."
Yeah. I mean, it's really the part of the same coin, if you will. Women, like my grandmother's generation, used to measure their waistline pretty religiously. Men doing that all the time with body fat percentages and talking about body fat percentages needing to be lower, this and that as a reflection of harder work. No. Also, this rejection of quote unquote visceral fat, y'all. I'm going to piss some people off, but guess what? Your organs are all visceral. So visceral fat is the fat around your organs that's meant to be there to protect them as you are an entity in space and moving all the time. So it's not something to be trying to eliminate. It will hurt your organs more than help. Anyways, I'm on another tangent. I'm going to get back off of that one. Okay, men, you don't have to suffer in silence. And we also know there are barriers that make it harder other than social barriers to finally stepping into the light and getting the help you deserve. Do you want to name another barrier to getting care specifically?
Yeah, I think, Erin, you named it right as we started off our conversation with one another. Lack of access to male providers
Yeah.
can be a really big barrier for men choosing to maybe seek help and seek treatment for their eating disorder. I think that's a really big one. Another one too that kept me back from ever receiving formalized treatment for my eating disorder was there was no representation of me like in programming, right?
Yeah.
And so
You're saying
why
when you're like in a higher level of care milieu, a community milieu, everyone's talking about bonding together through this traumatic experience of having a disease state, but you don't have any peers.
Yep. Yep. Absolutely. And so that I would imagine feels very isolating for men
Yeah.
that do seek higher levels of care and find themselves in higher levels of care. And so I'd say that's definitely a big one for me as well.
Yeah. And I think too, just to name, though there are a lot of pressures in gay communities around body, this is not just gay men get eating disorders, right?
Not at all. And I think what feels, I don't know if frustrating is the right word, Erin, but
Mm, use it.
I think it does feel frustrating that I feel like of the men that do choose to share their story of
Yeah.
living with an eating disorder, a good majority of them are gay. And I think where the frustration comes in is like, I know there are straight men out
Yeah.
there or, other sexualities, right? Not just gay. But I think there are other people out there who aren't gay that are struggling with an eating disorder. But
Yeah.
because I only see gay men sharing their story, that once again, there's going to be that judgment factor coming in of like, oh, people are going to think I'm gay because I'm living with an eating disorder.
I think if anything, my reframe was like, man, it's power there. I mean, when you're used to being in a marginalized, discriminated identity, it's kind of like, what do you have to lose too, right? Like, might as well spread awareness to help more people. So I think it's a strength and it proves strength. And we need an antidote to male fragility and letting people know that there's actually strength in vulnerability. Brene Brown said it best, like, you are actually really freaking brave and powerful and courageous when you allow vulnerability in your life.
And I think that's going to be an uphill battle. It's going to be a lot of
Totally.
work. And I think it starts honestly with how are we talking about emotions, emotional vulnerability with today's youth?
Yeah.
And to be honest, I feel like they're doing a pretty darn good job at it so
It does
far.
seem to be getting better. Every generation, there's improvement. When I was growing up, it felt like it was better than what was before me. So I do think it can only get better, perhaps. And there's just always new challenges too. But I think it's like, how do we talk about men's bodies? We do objectify men's bodies, especially in Hollywood and celebrity worlds. The fact that I even called Chris Pratt a hottie for Guardians of the Galaxy. Sorry, you are still a good looking guy in the office too, okay? But you have Zac Efron really opening up about just how much getting into shape for Baywatch was awful for him, how he had more anxiety and depression symptoms than he ever did in his earlier careers, even as a teenage actor. We know they go through a lot of stressful things. Ed Sheeran also getting commented about his body. I mean, it's just unfair. The way we think bodies exist for our judgment and commentary too is problematic for everybody.
And I even think too, we're kind of getting into this territory of talking about athletes and how
Hmm.
even they're really susceptible I think, to
Totally.
the objectification of their bodies as well, and how certain athletes, like for those that are wrestlers in particular, right? They
Yeah.
are at very, very, very high risk for developing an eating disorder, right? I think that just, I get so worried every time I hear someone share they're a wrestler. Like, I get just nervous because I
Yeah.
know just like that weight cycling, right? And the extent to which they either need to cut to make a lower weight class or bulk to hit the next upper
Yeah.
weight class. It is so hard on the body. So I think, yeah, my mind just goes to, as you were sharing though, too, Erin, I know you talked about the male body being objectified. I want to hold space for that. But even as a male, I think, and really wanting to try to raise awareness and create space for men, I think I'm also starting to realize too of like, okay, the men, like men can have their experience, right? But women
Hmm.
are also able to have their experience too, right? And I think
Hmm.
I'm recognizing like the history of women's bodies being objectified
Mm. Yeah.
and being more mindful of that. And especially as I continue to dive deeper into advocacy work, it's how do I honor and create space for both?
Yeah, totally.
One
There
is
are a
not,
lot of things systemically that have been going on and just established and accepted as normal that was toxic as hell, y'all. Toxic as hell.
and one is not more important than the other.
Exactly. Totally. All boats rise, right? If we do this right.
Yep, absolutely.
My goodness, it really is astounding. And the more I do this work too, the more I find myself rejecting consumer culture in general and beauty culture, even around aging. But I'm getting off on another tangent there. We're coming back to this. So, what do you recommend though to men that are listening who are maybe feeling inspired after hearing you speak of, I don't want to be silent anymore. I want to get help. But knowing there's that barrier of, you're right, it is hard to find a male provider. So, what would you recommend to individuals who are beginning this journey? How can they find providers that they
Hmm.
can trust and feel
Yeah,
safe with?
that's a great question. I feel like, honestly, what might be a nice stepping stone, maybe going to a provider feels really intense and really scary in the moment. But what could it look like if you chose to share your struggles first with someone else?
Someone,
Because I think there's healing that takes place when you choose to be vulnerable and share your story. For me, sharing my story allowed me to release some of the shame and guilt I had with my struggles. And stepping into vulnerability is such a gift, I think. It's a gift that we can give ourselves. It can be scary and a gift at the same time.
yeah. Did you have an expectation or maybe the catastrophizing version of what would happen if you told someone? And then how did that match to what actually happened?
Yeah, I mean, I feel like what played out in my mind was there was going to be a lot of judgment of sharing my struggles with food and with body image. And what I find really interesting, though, Erin, is I actually never chose to share my story of living with an eating disorder until I was in a really steady place of recovery.
Interesting.
And so this is where I do a lot of reframing myself. I often wonder what it looks like if I would have chosen vulnerability and shared my struggles with someone and gotten the help that I knew I needed when I was struggling. And I feel very grateful that I was able to find recovery.
Yeah.
But after experiencing that in isolation, that is something I never want other individuals to have to experience
Mm,
because everyone deserves support. Men, if you're listening, you deserve support. Try sharing your story first, see how that
yeah.
goes. But then I think from there, and you're kind of looking in terms of finding a provider, there are very limited options for finding a male provider in the eating disorder space. Psychology Today, even, right? And searching therapists in your area and seeing if any of them maybe specialize in seeing individuals with eating disorders, right? Read their bio. What do they value? Do you feel like you would mesh well? Do they have similar passions as you? Because
Totally.
even though you might not see your gender reflected in the treatment space, I can guarantee you the person sitting in that chair across from you is there and wants to help you.
Could not agree with that more. What are some other resources that you usually recommend to people who are new to finding help, where do you normally recommend they seek support?
Absolutely. So for men in particular, I always have to give ANAD a shout out here. They host a men's support group, which I think is really valuable to be able to have a male specific support group for men to enter into and to talk about some of these concepts that we've chatted about in our conversation, Erin, of
Yeah,
what does masculinity mean to you and how does that influence how you maneuver recovery
totally.
and embracing your struggles with your eating disorder.
Yeah. I love
Uh,
the Alliance too. They have free peer support groups and moderated groups. The Eating Disorder Foundation too. It's out of Denver, but they have virtual groups. Love them. They're more.
I feel like ANAD's always my go-to.
They're a little biased, but it's okay. It's
Yeah.
okay. They do a great job. Well, this has been just so important. Again, I'm so grateful for all the work you do in raising awareness in helping shed stigma around men's mental health and men's eating disorder recovery specifically. So thank you. And thank you so much for joining me today. I appreciate it.
Thank you so much for having me. I enjoyed this conversation.
It was awesome. This is Doc Talk with Dr. Erin Knopf. We will see you next time.